Oh, my name is Lasya. I'm from Marquette High School.
Hi, my name is Sheryl. I'm also from Marquette.
Nice to meet you.
You too.
Yeah. And I'm Shaily, and all three of us are seniors at Marquette High School.
Wonderful. Nice to meet you. I'm Dr. Glowinski. I'm the Training and Education Director at Washington University School of Medicine for Child Psychiatry. I'm also the Associate Division Director. I'm known for being a scholar who has written about depression, suicidality in particular, but a lot of other things. And for being a teacher for physicians, medical students, and also obviously people who want to become child psychiatrists or psychiatrists. And I also have a clinic where I see young people.
So I guess I'll get started with the questions. So the COVID-19 pandemic has caused a lot of stress and anxiety to many patients. What are some of the things that you're noticing in your patients, and what are some of the things that people should do to cope with the stress and anxiety?
In general, there have been various effects. So at first, I think some of the people your age and younger are anxious about going to school, which is a common problem that I see. I think initially there was relief, because they didn't have to go to school. So for people who had social anxiety, there was a period of almost relief. But that was also balanced by the fact that I think for a lot of you guys, the experience of online teaching was not ideal. It's not something that teachers had months to prepare so that it could go well. So essentially, teachers had to convert their curriculum and do it very fast. And teachers were anxious, So my experience with my patients and my own children is that the online teaching was not perfect. It didn't feel great. So that became a stressor for all my patients, including the ones that initially were glad to be at home. Then for a lot of children, so the ones who were depressed, what I started seeing is that after a while, the burden of behavioral inactivation. So what I'm referring to is that one of the things that we do when we're depressed, besides sometimes prescribe antidepressant or forms of psychotherapy that help with depression, is that we tell people to try to behave like they're not depressed, because it becomes a cycle, in the same way that depressed thoughts tell you, I want to stay in bed, I just don't want to do anything with my friends. So then you get more depressed. Well, in the same way, and this is very important in countries where there's not a lot of meat, this is a main form of treatment. You tell people, okay, get out of bed, go see your friends. Maybe pick your friends who are the most gentle, but don't just stay in your room. So basically, there was this massive behavioral inactivation for a lot of young people of being less outside. Obviously, this varied because there were parts of Missouri where we are, where people weren't wearing masks and were not social distancing, but still there was social isolation from the usual peer group, right? So that became more depressogenic rapidly. The other thing that was more depressogenic often was being at home with parents, or being with parents who are way preoccupied and stretched thin because of financial worries, the juggling, fears for their children, etc. So I think in general, some of the disorders that are very influenced by other family members, like anxiety is very contagious in a family. And then depression, it's not that you can catch depression if people are depressed, but basically stress and anxiety can make your depression come out. So we saw that happen. Initially, people were afraid, I think, of going out. So our emergency room was not busy very briefly. And then it's been busier than ever with, I think, kids attempting suicide and kids having a lot of difficulties. So I would say that we don't have hard data, but my experience as a clinician and my experience with other clinicians also around the country, because I belong to some national committees, is that things have been hard for people with mental illnesses. Was that the kind of answer you were looking for?
Yes, it was. Yes, thank you.
Right. Of course.
So I know that there are like some people who think mental illness is not that common in like children or like really uncommon. So like how common is it really? And like are there early symptoms that that are like noticeable to us where we can maybe tell that a child is developing a mental illness?
So that's a very good question. Mental illness, if you include mild ones, are incredibly common. So basically, the idea that it's maybe like a common cold that at some point in your, like a lot of people will have one panic attack in their life. A lot of people will have a stress reaction to things that are difficult. A lot of people will have mild anxiety. When it comes to more moderate to severe illness, that's rare. And so part of the importance of your question is, okay, what do you observe, but also for how long? So in a sense, you're not just looking at what symptoms are you observing, but also how long are they lasting. And then there are some exceptions, right? So if you have significant ideas that you want to kill yourself, it doesn't matter if it doesn't for several days. If they're very strong and they scare you, that's something that should be evaluated, right? So it's a little bit different than, for example, being a teenager and walking around and especially now thinking, I'm not sure life is worth living. That's probably a reasonably common thought. Almost 50% of kids maybe are having that thought at your age. And I would say that it's a sign of how stressful things are, but it's maybe, and how hard it is to be your age, but it's not necessarily a symptom of illness. However, if you start feeling that you just can't help it, you might do something to yourself, you might kill yourself, that's a different story. So that would be a very easy symptom. But other things would be like not being able to sleep for many days, or waking up at night regularly with anxieties or worries, or just not being able to go back to sleep. Somebody who stops eating completely, so that can, or almost completely, that can happen with anorexia, that can happen with depression. So it's not uncommon in your age group to have anxiety and then experience these things. But it's a signal that you need help if you're having those. Does that help a little bit?
Yeah, that was perfect.
Okay.
All right, thank you for all that information. So I guess our next question would just be like, obviously you talked about how this is causing a lot of anxiety for people. So what are some things people can do at home to stay healthy, like physically and emotionally during this pandemic?
So rituals are very important, and it doesn't mean like if you have a culture that has a lot of rituals or religion, those can be helpful if they're not oppressive, but they can be helpful. But you can have your own rituals, so the sport that you like can be an enormous stress relief. Do it for you, even more than competition at this point. We know that obviously if your body feels good, it's harder to feel anxious and feel bad. And this is especially helpful for people who are at risk of mild symptoms. The other thing is eating healthy, trying to do the very hard thing of going to bed at around the same time and sleeping enough, because sleep is incredibly important to your mental health. Connecting. So not forgetting that interhuman connection, or sometimes connection with animals, is incredibly important, like oxygen, so connecting, and also connecting with people who feel good for you, so it doesn't mean connecting with just about everybody, but it could be connecting with people that are especially special for you and that have an intimacy with you, so it feels good, like a protected little world, and you recharge. Art, even if that's not something that you do, if you just put yourself in front of a piece of paper and you just draw, reading, and also monitoring what you're doing with things that may be like a band-aid, like watching a ton of shows or playing video games, but don't necessarily have the same beneficial effect on you than doing something like reading a new book or talking to a friend or exercising. So nature, walking in nature, hanging out with plants.
That's awesome. I think that's all we have for you today. Is there anything else you would like to add on about what we should do?
Well, I want you guys to tell me about stigma.
Okay.
Like what's your experience of it, and how, like, because you're right, stigma is as painful, in fact, as mental illness, and people usually have both. So what do you see, and is there anything you want me to tell you about that?
So as high schoolers, I think we definitely see a lot of stigma at our school. A lot of students don't want to open up about their mental illness, and they feel that it's normal to be like anxious or stressed all the time. So I think there's like a strong divide between people that see it as normal and people like that don't understand like what it actually is. So I think that's like something that we notice at like a high school. Is there anything Shaily and Sheryl you want to add on?
Yeah, I feel like especially a lot of parents, like they might not really understand that, like, a lot of things that we're going through, like they don't understand that. And like sometimes, like I've talked to a lot of adults and sometimes they kind of feel like, mental illness like really isn't like such a big deal when it really is. But like they kind of don't really understand that. And I feel like that's like a really big problem in society. And I just feel like, just gotta try and like fix that.
No,
Yeah.
Did you want to say something?
No, I was just gonna say, like, kind of like you said, there's a difference between these normal thoughts that every teenager has, and obviously thoughts that like maybe you need to get help for or are indication of a mental illness. And so I think like because of the stigma, sometimes people there's a fine line between them, and sometimes people have difficulty distinguishing between those types of thoughts because they either don't want to talk about it or they're afraid or they feel embarrassed.
Something that I tell my patients would be that, first of all, when they get a diagnosis and they get really worried about who do I tell, and the answer is the same thing as the connection conversation, in a sense. You certainly don't have to tell everybody. Like, would you tell everybody about everything that happens in your life? No. But at the beginning, when you're getting used to this, I think it's important to find a few people, either friends who have had experiences that you already know about or friends who are particularly open-minded to talk to. Parents are a tough one because mental health is something that everybody thinks they're an expert about, and so you will hear things like just lift weights more, or eat more carrots, or you need to sleep more, or don't hang out with your friend Timothy is a bad influence, and so to help parents really see that this is a form of suffering that is as bad as having it's a physical illness. It just comes in your mind. I think that you may need the help of doctors or resources, so there are things online, I think, that people could just say, here, mom, watch this. Like if you Google AACAP, the American Academy for Child and Adolescent Psychiatry, has facts for parents, which are really written for entry-level parents looking for information. So not for parents who have a lot of experience with mental health problems. The other thing I would say with stigma is recognizing that it is a scourge, and that sometimes the most effective way to change people's mind, as long as you're okay with it and as long as it feels good for you, would be if you have an experience with mental health issues and you own it and you to talk about it, to actually do that, and model that here is somebody that maybe mom and dad didn't think had depression, but they did, so this can happen to every parent, that they can miss that because of their expectations, so.
Thank you for that. Thank you.
Of course, thank you for all of you. I hope that you think about becoming child psychiatrists. It's the most underserved medical specialty in the whole world.
Oh, wow.
So,
Wow, that's
think big. Don't
Yeah.
let people tell you to think small. Think big, and also remember to be happy yourself, which is a hard balance, but
yeah.
you're a very inspiring generation.
Thank you.
Thank you so much. That means a lot.
Of course. Have a great day.
Thank you.
Thank you.
You too.
Bye bye.
Yeah.